Hello, my name is Faraz Haghighatjou. I am a graduate student at William Patterson University, majoring in exercise science and sports studies. My thesis proposal is on endurance athletic hydration testing and physiological responses. The overview of my study, we're going to go through introduction of this thesis proposal, the purpose, methods and procedures. We're going to talk about the research that is being done and the results of that. And we're going to discuss a little bit of what happened in the result of that research and the summary of my research and also reference or citation. So the introduction, I'd like to speak a little bit about endurance training and what happens when athletes do aerobic training or long duration. Endurance training usually breaks down into two categories: general or specific. And longer duration training, as we know, puts a little bit more stress on cardiovascular system and also simple muscular endurance. Endurance training or in sports basically happens in athletes who do marathon or long distance bike riding or competitive swimming. Of course, we're going to talk about hydration, dehydration, electrolyte balance, and the physiological responses. How we do athletic, basically urination testing, because that's how we'll be able to determine if somebody is hydrated or not, and program design during competition or training. If we talk a little bit about physiological responses, they happen centrally or peripherally, and basically some cardiovascular adaptations that happen as a result of endurance training is decrease in heart rate, increase in stroke volume. As we know, the blood plasma level goes up, blood viscosity goes down, cardiac output goes up, and mitochondria also goes up in numbers and size. The methods of endurance training breaks down into a few factors, such as long, slow distance training or high intensity interval training, which is that's what they're doing in the past few years. They really concentrated on high intensity interval training. The most important part of it is periodization, or the programming part of it that helps athletes to perform better. So as we go through hydration, basically body is constantly working to control its temperature for homeostasis balance. If hydration is not maintained and core temperature changes, then it can be life-threatening, such as hypothermia or low core temperature, or hypothermia or increased in core temperature. In order to perform properly, specifically during competition training, is to replace the fluids at regular interval and with the appropriate amount. So that's how we'll be able to increase athletic performance and keep our athlete hydrated as they go through an event, pre, during, and post. So electrolyte balance is important to maintain homeostasis, of course. As we mentioned earlier, electrolytes are usually found in fruit juice, coconut water, or sports drinks, and milk. Of course, there are other things that have electrolytes, but these are just a few examples. Electrolyte drinking contains sodium, potassium salts that replenish the body's water and electrolyte levels after dehydration caused by exercise. So as we know, while you're exercising, specifically going through longer duration periods, athletes tend to get dehydrated because the exercise intensity increases core body temperature, and athletes seem to get dehydrated, get headaches, feel the dizziness sometimes, and that's due to the fluid being vaporized basically from the body. So As we go through this presentation, the purpose of it is to the goal of this research is to prove that hydration carries physiological benefits for endurance athletic performance, and how we'll be able to tell if somebody is hydrated or not. We'll be talking about that more specifically in details. Um, so. So basically, before we go through the research and how it was done, basically the proper way to determine hydration level is being maintained during athletic performance is by urination sampling or urination testing of athletes. If we want to exactly find out if they're hydrated or not, or have enough fluid in their body during an event, we have to think about their pre-competition. We have to test them during the competition, and we also have to test them post-competition. This research basically shows an assessment of the hydration status of recreational endurance athletes during mountain marathon events by this research was done by Mahon and is very recent in 2014. So the methodology of it shows that there are 29 male recreational athletes that done original mountain marathon, which we call them OMM group, or 19 male recreational athletes that done long mine hike, or we call them LH group, for example. The urination sample test was done before the event, during the event, after the event. The factors that was recorded during this research was the body mass in kilogram reaction time testing, also subjective ratings of well-being of the participants and their efforts. So the result of this, basically, just to give you a little clear idea of what the urination testing looks like, or what factors the professionals review during the urination testing is color coding, clarity, odor or smell, specific gravity level, with checks for the amount of substances in the urine. Sometimes they look at pH, which shows the how acidic or base urine is, or sometimes in some cases, if the protein appears to be in the urine, then there are other things involved. But as far as the result concerned for this research, the OMM group post-urination specific gravity level is 1.023 G per ml. Then you have the LH group that shows 1.024 G per ml. And the result of that is that there's significantly higher pre-values. So from pre to mid event, the results are showing improved in athletic performance. I'm going to show you what that means in the discussion. And basically, the note on the bottom mentions that there are no specific significant changes from mid to post or to the end of the event. Now, as we go through the discussion, you see that the values pre to mid increased performance, no changes in LH and performance group. There was no associations were observed for hydration status together with reaction time and intensity, or rate of perceived exertion. Some athletes were well hydrated, and others significantly got dehydrated. Signs of it was that they experienced headaches, cramps, or nausea. The conclusion of this study, basically, longer duration activities, they require you to be hydrated and maintain your hydration levels or electrolyte balance. If you don't, then you're going to be in trouble as far as athletic performance. Obviously will decrease by tremendous amount, and it will cause other complications. The testing should be done pre, during, and post athletic events. The levels of hydration basically depends on duration and intensity of the exercise program or the training program, and urination sampling and hydration level are related, because I feel that if if someone is not hydrated, then you're going to see significant changes as far as urination and the color and the odor of that, and it needs to be taken care of during the event. That's why health and fitness professionals always mention that hydration should be maintained before, during, and after an exercise program. Fluid intake for endurance athletes is 0.8 to 1 liter per hour of an activity, but if you ask me, I would say definitely drink a well amount, so you're not dehydrated, but you don't want to overdrink, so you feel bloated and you can't perform well. These are my references cited. The second reference is basically the assessment that was done, and all the notes was basically included in the reference and citation. And are there any questions? Thank you very much for paying attention to me, and if there are any questions, please comment. Thank you.